be inserting a catheterization on a female patient. It's page 559 to 562, your fundamentals handbook. First thing you're going to want to do is you're going to want to check your doctor's orders, making sure that you have an order to insert the Foley. And I do. You're going to want to gather your supplies. You're going to want a Foley catheter kit, usually 14 to 16 French is appropriate for your patient, female, and a draw sheet. You're going to go in and talk to your patient. You're always going to go in and explain the procedure to them, explain that they're going to have a Foley catheter inserted, and you're going to want to ID your patient, name and date of birth. Once you've done so, you're going to raise your patient to the correct height. First of all, you want to make sure that you do some hand hygiene, and then raise your patient to the correct height. Don't ever walk away from the bed with the bed in the high position. You want to make sure that you have it at a comfortable height for you and for the patient. And then you're going to get your patient ready. You're going to remove the blankets. And ask your patient about any hip problems or anything like that, because you're going to place them in a recumbent position with their legs spread wide apart. I usually leave this for your patient just for now, and you have a draw sheet to use also, just to keep your patient comfortable. This keeps them from feeling exposed. Doing okay? You're going to check your kit, make sure that you have everything, make sure that the outside of the box is not ripped, torn, nothing leaking. Check your expiration date. If everything is good, you're going to open your package. Taking this small bag, just turn it in on itself, make it a small, short, squatty trash bag, and you put that towards the end of your bed. Extra paper, and now you're going to get your patient ready. You're going to bring all this back out of the way so that you're able to visualize your area, and bring over your sterile packaging. You are going to place that sterile package, and you're going to open that package just like you did in the previous video. Pulling it away from you, grabbing that 1-inch border, and pulling it down, grabbing it, pulling it down, and then grabbing it and pulling it down. And you want to make sure that it stays to where it does not fold back on itself. The first piece that you will see is going to be a draw sheet. You're going to grab it at the corner, lift it up and away, grab another corner. You have a 1-inch border that is not sterile. I don't know if you can see my hands. My left hand is on this side behind the drape with the right hand. If it doesn't lay completely open, you can try to move it around to get that to open up, but you have a 1-inch border. Now it's completely flat. You will take this and you will come down and in and drop it. Reaching behind your patient's legs, ask them to lift their bottom and bring that up underneath of them. No time have you crossed your sterile field. Now you have a sterile field, you're going to reach in and grab your cuffs, place them on the bedside table, opening them up so you have right and left. With your non-dominant hand, you're going to pinch the cuff, lifting it up and away, and inserting your hand. Once that one's on, you're going to reach under the cuff of the other one, lift it up and away, and insert your hand. At this point, your hands are sterile, and you want to keep everything else that you touch now sterile. The second piece we do not use. You bring it out and drop it into your trash bag. First thing you're going to do is open your betadine. For purposes of this procedure, we're not going to open it all the way, but you do open it and dump it on your cotton balls. Once you've done so, I have both hands on it. I'm going to grasp it with my right hand, bring it back, and drop it. I'm going to take my box. Each instructor does it how they choose. I choose to have my catheter up front with my supplies in the back. I'm going to open my lube and inject it, and then bring it back towards me and drop it. Grasping the cap that I have in my other hand, bring it back over and drop it. You're always coming back and away from your sterile field. You have a syringe with water that is used for the balloon of the catheter. The catheter is set up with a sheath around it. You just want to tear this down and away, letting this catheter feed itself back into the box. And you're going to bring this back and away and drop it. So you have your catheter. I take my syringe. You can drop this, it's sterile, right back into here. I place it in there so that it's ready to go. Now, I'm ready to touch my patient. Once I have touched my patient, this hand will no longer be sterile. So you're going to grab your patient, opening the majora and minora, and making sure it's open so that you can see. You do not want this to fall back on itself. Grasping your betadine cotton ball, you're going to come in, wipe down one side, come back and away, and let it drop. You're going to come back down the second side, come back and away, and let it drop. You'll grasp another, come straight down the middle, and let it drop. Once you're finished with your tongs, if you have inadvertently let it grasp on itself, you will have to start again. As you can see, my hands had slipped, and it did, so I'm going to start again. I come down and away, and back around, come down and away, back around, come down the middle, and then back around, and dropping everything into the trash. From here, I'm going to take my catheter, I'm going to lube it. Once I have it lubed, I'm going to insert, pushing it in, grasping it with those fingers, and just let it feed in. Once I feel that I have seen urine, grasp it with the other hand, and inflate that balloon, asking if they are feeling any pain. If they are, advance the catheter. If not, continue to fill the balloon. Once you've done that, take this off and drop it and pull back on the catheter. Once you feel resistance, leave that alone. I discard these gloves because they are dirty. And then I take my clean bag, put it on the side of the bed, and then grab gloves, clean up all of this, get it out of the patient's way. You're going to want to clean your patient off, and you'll want to secure the catheter with a provided catheter holder or with tape. Make sure you always secure it to the patient's leg. And that is how you insert a Foley catheter.